Good morning. Thank you for joining us for today's Regional Economic Conditions webinar on the health of Minnesota's childcare sector. I am Rob Grunewald, economist in the Community Development and Engagement Division at the Minneapolis Fed. Today's webinar is part of a series of webinars on regional economic conditions in the Federal Reserve's 9th District. You can view previous webinars in the series on the Minneapolis Fed's website. The next webinar in the series will be held this Thursday, May 13th, on agricultural credit conditions. Today's session will focus on Minnesota's childcare providers. The availability of quality childcare can have a substantial impact on parental workforce participation, job stability, and wages. We also recognize that the experience children have in childcare can influence their development and their trajectory going into school, a topic the Minneapolis Fed has analyzed for a number of years. Research shows that high quality early care and education programs can help children prepare to succeed in school, and the associated benefits can yield a high societal return on investment, particularly when reaching our most vulnerable children. And we'll go to the next slide. The COVID-19 pandemic brought a number of unique costs to the childcare sector in order to maintain a healthy and safe environment, including increased sanitization and personal protective equipment costs, temporary closures due to COVID-19 exposure, and maintaining smaller group sizes with associated reductions in revenue. At the same time, government and businesses have recognized childcare as a necessary workforce support so that essential workers with young children could get to their jobs, and parents who left work or lost their jobs could re-enter the workforce and support the economic recovery. Financial assistance from the state of Minnesota and the federal government to childcare providers has helped buffer some of the costs of providing childcare during the pandemic, but the environment remains very challenging. Recently, the Minneapolis Fed's regional outreach team has been focusing more on the experience of workers and the importance of labor force participation in economic growth. They frequently hear from their contacts about the impact that childcare or the lack thereof has on both workers and employers. This interest led the Minneapolis Fed to connect with First Children's Finance, a nonprofit working to increase the availability of high-quality childcare and early education. This joint survey is one way to better understand the challenges that providers face. To present information about First Children's Finance and the results of the survey, we are delighted to have Suzanne Pearl, Minnesota Director at First Children's Finance, join us this morning. We will have a few minutes after Suzanne's presentation to answer your questions. And you're also welcome to drop those questions into the Zoom chat at any time. Suzanne, I'll turn the program over to you.
Good morning. Thank you, Rob. I am happy to be with all of you this morning. And as Rob said, this survey was an effort on our part to learn more about the childcare providers that we are working with. And I'd like to share a little bit about my organization, First Children's Finance. We are a national nonprofit organization based in Minneapolis. This is our 30th year of working to build the supply and financial sustainability of quality childcare. We work toward that on 3 levels, shown in our graphic here. We work with individual childcare businesses, providing business training for licensed family providers and childcare centers, as well as consulting services such as financial analysis, enrollment management, facilities planning, and organizational management. We work at the community level in Minnesota through our Rural Childcare Innovation Program, where we help communities assess their childcare needs and develop community-specific solutions to support existing childcare and, where needed, bring on new childcare programs. We also work at the systems level with state governments and other government entities to effect policy changes that can increase the supply and sustainability of childcare. Our work with childcare providers has never been more important than it has been during the pandemic. A lot of childcare providers don't consider themselves as entrepreneurs or small business owners. They got into childcare because they wanted to help out working families and their children. Most do not have a business background outside of childcare. Many family providers run their businesses out of a few file folders at their kitchen table. So when the pandemic hit, many providers, both family providers and center directors, were not ready with the financial statements and information needed to apply for available financing opportunities. We spent a lot of time last spring helping providers figure out their financial information and how to, for example, how to apply for PPP loans or state grants. And our business trainings have been more in demand than ever this year. So from our experience, we had a lot of anecdotal information about the financial position of childcare businesses. This survey was our effort to back up those anecdotes with data. And one thing before I start, I also want to acknowledge that today, May 7th, is National Child Care Provider Appreciation Day. So thank you to any of you in the audience who are child care providers for the work that you do. I also want to thank all of the child care providers who responded to our survey, as well as partners from Child Care Aware, some of the initiative foundations, county licensors who helped to distribute the survey. We were really impressed by the response. We received 781 responses. That is roughly 8% of all child care providers in Minnesota. Digging in a little closer on who responded, we show by provider type. Family providers are about 85% of the respondents. Child care centers about 14%. That's roughly the distribution of family versus centers in the state of Minnesota. Right now in Minnesota, we have about 7,500 family providers and about 1,500 childcare centers. We had a really nice regional distribution of survey respondents. You can see every region of the state is well represented in the survey. And we also broke it down by race and ethnicity. About 6% of our survey respondents are self-reported to be racial and or ethnic minorities. We think this is relatively similar to actual numbers. So the first questions in our survey were meant to capture data on enrollment throughout the pandemic, going back to last March. We asked survey respondents about their enrollment levels during the pandemic and invited them to select all answers that apply. And before I dig into this, while this might be an obvious point to make, in childcare, enrollment equals revenue. So decreases in enrollment went directly to the bottom line of these businesses. You can see that both family programs and childcare centers experienced substantial decreases in enrollment, illustrating in part a considerable decrease in childcare demand. And you'll note, excuse me, that the decrease in enrollment was larger for childcare centers. Many centers decided to close their doors right away when families started pulling their kids out. Many had to lay off staff. Some had staff quit due to either concerns about exposure to COVID or an actual exposure to COVID. Also, the business model for childcare centers has more fixed costs than family childcare, so decreases in enrollment can be more difficult to ride out. But the takeaway here is that we saw substantial decreases in enrollment for both family programs and childcare centers. We also wanted to know where we are as far as economic recovery. So we also asked about enrollment changes over the past 3 months. And given the timing of the survey, this would have been January to March of this year. That was the 3-month window in question. You can see that childcare centers in particular are reporting increased enrollment, or which could mean increased demand or an increased ability to meet that demand. Family programs, on the other hand, are still reporting more decreased enrollment than increased enrollment. This relatively stronger comeback by childcare centers is consistent with what we're hearing anecdotally, particularly with regard to metro area childcare centers, as more people are going back to work. We broke out enrollment changes by region, and the similarity across the entire state is striking. You can see we've got the metro area here and then greater Minnesota regions as well. We do see a slightly higher decrease in enrollment in the 7-county metro compared with greater Minnesota. That could be due to a larger proportion of childcare centers in the metro. We just saw earlier that centers reported a higher decrease in enrollment. There may also have been a larger share of workers in the metro who were either unemployed or working from home and had older kids at home and chose to pull their kids out of care. This could also indicate differences in geographic hesitancy to use childcare during the pandemic due to concerns of COVID exposure. But really our takeaway here is that providers in every region of the state reported significant decreases in enrollment over the course of the pandemic. And looking at the 3-month changes, you can see much more stability. That's the orange bar here, reporting no change or stable in enrollment. The metro data on the left is consistent with gains made by child care centers in the previous slides. But still, all regions of the state are still showing decreased enrollment, even at this late point in the pandemic. We were curious about disparities between racial and ethnic minority-owned businesses and non-Hispanic white-owned businesses. And you'll see here that racial, ethnic, minority-owned childcare businesses did report decreased enrollment at a higher rate, 74%, as opposed to 52% of non-Hispanic white-owned childcare businesses. You can also see that non-Hispanic white-owned childcare maintained stable enrollment at a higher rate than racial, ethnic, minority-owned childcare businesses. And again, at the past 3 months, while fewer providers overall are reporting decreased enrollment during this time period, the disparities between racial, ethnic, minority, and non-Hispanic white remain about the same as they have been through the course of the pandemic. Moving away from enrollment, we also wanted to look at staffing. These next 2 slides show data from childcare centers only. For those of you who may not be as familiar with childcare, the state of Minnesota has pretty strict regulations on how many staff are required for a certain number of kids in care, and those requirements differ across age groups. For example, the ratio of childcare staff to infants is smaller than the ratio of childcare staff to preschool age kids. So if a childcare center doesn't have enough staff, they can't meet their ratios and therefore cannot have enrollment at their licensed capacity. It's important to note that hiring and retaining childcare staff has been an issue for some time. Pre-pandemic, the childcare sector was having difficulty attracting new childcare professionals, as well as retaining those already in the sector. We're also seeing a large demographic shift with many childcare providers retiring, aging out, and we're not kind of backfilling those positions. This is particularly prevalent with family childcare. Compensation is notoriously low in childcare. The average salary of childcare staff in Minnesota is about $12 an hour. While the work is rewarding, it can also be very difficult with long hours compared to similarly compensated positions. But we can see in this slide that centers clearly have struggled to maintain staffing during the pandemic. There could be any number of factors at play here, in addition to the pre-existing issues of compensation and benefits. And we're seeing this across the economy with businesses struggling to find workers to take lower wage positions. Staff retention during the pandemic may also have been impacted by people being wary of exposure to the virus or not being able to secure their own childcare. But in any case, the inability to hire and retain staff will continue to hinder the sector's ability to support the economy as more people get back to work and the demand for childcare climbs back up. I also want to highlight the category here of maintaining higher staff than required. There could be several reasons for this to be an issue for a childcare center. Some brought in additional staff to help with safety protocols. For example, they might have had one designated staff person at drop-off and pickup to deliver kids to their parents at the door. They may have wanted to keep staff just because it's so hard to hire and they have invested training and other time into staff. And there also may have been compliance requirements with, for example, PPP loans or other funding that required them to keep all staff on in order to receive that financing. This slide we thought was really just kind of amazing. We asked how difficult or easy it was to find qualified workers. And it's not just that finding qualified staff is an issue. More than 90% of childcare centers report that it's difficult or very difficult to find qualified workers. And I can imagine someone, a childcare center director, filling out this survey and getting to this question and just kind of scoffing that very easy and easy were even listed as options. We asked about payroll, and you can see that childcare centers reported more difficulty than family providers. And when we talk about payroll for family providers, we are talking about whether or not they're paying themselves. We heard from several family providers over the course of the pandemic that increased costs due to the pandemic, including PPE, cleaning supplies, et cetera, combined with decreased enrollment, meant that they were essentially paying out money in order to run their family childcare business. Again, this goes back to decreased enrollment equals decreased revenue, and thus the difficulty in meeting fixed costs. You can also see here that racial ethnic minorities reported more difficulty than non-Hispanic white providers. Along those same lines, we have some data that gets to the issue of how financial struggles of childcare businesses had significant impacts on the personal finances of childcare providers. High rates of respondents in all categories reported that their household incomes were impacted by financial losses in their businesses. We heard from centers who were struggling to pay their fixed costs. We know some center directors who didn't take a paycheck so that they could pay their employees. And we know of at least a couple of providers who took out loans to keep their centers open, but ended up having to put up their own house as collateral to get that financing. And again, we do see a higher reported household impact by racial and ethnic minority providers. We were interested in what the cash flow situation was for these businesses, what kind of capital they were working with. The good news here is how many respondents reported receiving government or other grants. The state of Minnesota did a great job and better than most states in propping up the childcare sector during the pandemic through first the peacetime emergency grants and then the public health support grants. However, note, even with that support, note the cash flow struggles. In particular, I want to call out the high rate of childcare providers who sought high interest financing. And by this, we describe this as credit cards or payday loans. 23% of childcare providers reported resorting to high interest financing. To me, that's alarmingly high. We also see a relatively high percentage of providers were able to obtain PPP loans, and that's great. Another interesting piece here is that only 14% of providers reported closing even temporarily for cash flow reasons. From the beginning of the pandemic, childcare providers were asked to stay open, and they did. They wanted to help the families that they serve, and many have suffered personal financial consequences because of it. Looking at the same information by provider type, once again, we see this very high rate of being able to obtain grant funding. We also see that while family providers tried many ways to obtain capital for their businesses, they did not raise tuition at the same rate as centers. You can see this bar here. This could be due to the fact that a lot of family providers don't really see themselves as business owners. They're trying to help families. And many providers, and this actually goes for both family and centers, told us they weren't comfortable increasing tuition for families who are already struggling. Along those same lines, we do see that quite a few more family providers than centers also sought out high interest financing. This is the same question with responses broken out demographically. While the experiences are relatively similar, we do see racial and ethnic disparities in a few areas. For example, having to use all of your emergency fund, again, resorting to high interest financing, and again, program closures. So looking forward, we wondered about the mindset of providers at the 1-year point in the pandemic. The green bars here are the number. So we asked, how long do you think you can stay in business with current economic conditions? The green bars are the number of providers who say that they are unsure of how long they can stay in business under current conditions. And that demonstrates the ongoing level of unpredictability of the childcare business. We've seen previously the impacts of the pandemic on enrollment, cash flow, staffing, and how that in turn impacts personal finances. One of our earlier slides showed that even in the early part of this year, providers were reporting significant decreases in enrollment, and that is very likely playing a part in this. Once again, the similarities across all regions of the state is striking. One other thing about this is the high level of providers answering unsure. That could also illustrate that not all providers, particularly family providers, feel comfortable with assessing their own financial viability, doing financial projections, or even knowing how to figure that out. And it just underlines the need for further assistance to childcare providers in the area of business management. Finally, we broke down those responses by provider type. And once again, unsure is pretty significant and pretty consistent. There is a somewhat larger share of centers facing uncertainty, and we are particularly going to watch the viability of childcare centers in greater Minnesota. You might note here that family childcare reports a higher rate of answering indefinitely, being able to stay in business, which could speak to the comparative resilience of the family childcare model, business model. Centers will have a tougher time attracting staff and maintaining enrollment. Demographics wise, again, we see a somewhat larger share of racial ethnic minority providers not sure about remaining in business, but it's not that far off from the level of uncertainty reported by non-Hispanic white providers. With that, I will say that if there are any childcare providers in the audience who are looking for help in managing the business side of their program, please don't hesitate to reach out. We also share a lot of our statewide childcare supply data on the website for our Rural Childcare Innovation Program at ruralchildcare.org. And with that, I'd love to take a question or two.
Great. Thank you, Suzanne. It was a very informative presentation and information. And we do have a few questions, so I'll start with those.
Right.
So you and your colleagues at First Children's Finance work closely with childcare providers on how to effectively manage the business aspect of a childcare program. From what you observed during the pandemic, do any of the survey results surprise you?
Yeah, the one thing that really popped out that was surprising and alarming was the percentage of childcare providers who reported utilizing high interest financing to stay in business during the pandemic. We expected there would be some, but 23% is a big chunk of childcare providers. And we hadn't necessarily heard that. We'd heard stories, but we hadn't heard it at that rate.
And we had a question, just a qualifying question about that.
Mm-hmm.
What is considered low interest financing and what is considered high interest financing in the survey?
That's a good question. We framed it as low interest financing is anything you might be able to get through a bank or a community foundation or a CDFI, and the high interest was credit cards and or payday loans.
Got it.
Mm-hmm.
So here's a very interesting question. We noticed, in the survey that there were some providers that noted that they increased enrollment. On net, it was down. Mm-hmm. Do we have any insights in terms of those providers that noted that they increased enrollment during the pandemic? Do we know why?
It would probably be a guess at this point. I think that there may have been some consolidation, particularly at the very beginning of the pandemic, where particularly families of essential workers were required to work more hours, and there were a number of centers in particular that were marketing directly to those families.
And I think there's also an interesting question too about the results, the relationship between enrollment and the struggle with staffing or lower staffing. Mm-hmm. And some of the enrollment was of course due to a decrease in demand, mm-hmm. but did we get a sense from the survey in terms of how staffing levels themselves may be pulling back enrollment?
We didn't ask that specific question, but anecdotally we hear that a lot, and this is particularly in greater Minnesota, particularly with childcare centers in greater Minnesota. There's a reason that family childcare is so strong in rural areas. It's just harder for a childcare center to operate. They've got fewer families as their target market. They've got, fewer, I guess, a lower group of people from whom to recruit staff, and with the fixed costs still the same.
There's, it's great to watch an active chat or questions coming in, because I'm getting a response to, one note is that, some providers took on school age kids.
Absolutely.
And so that would be a potential reason why that enrollment went up there.
Yep.
And going back to some more questions here as they're coming in. So in terms of the reasons providers say they aren't sure they will survive, did we get some insights of whether it was primarily of a financial issue or other reasons?
Some of the comments in the survey, we invited people to tell us how they were doing, really do speak to the economics. I said earlier that the state of Minnesota had done a great job in providing ongoing grants, and there's not a lot of certainty right now about how long those grants are going to continue. So I think they have been critical to the ability of childcare programs staying open. So that's one of the real big questions. If that support goes away, that really changes the calculation for both centers and family providers. And what we hear at this point is they just want to know if those grants are going to stay, if those grants are going to go away. Just tell us so we can plan.
Great. And one comment from a regional perspective, that you saw, there was a mapping of a lot of different spaces within Minnesota. We saw that on net there were these decreases. When we look at those greater Minnesota areas, and you see that there is some concern about providers not staying in. If you took any of those regions and you saw that there would be a loss, for example, in Southwest Minnesota, 18% not staying open beyond 12 months, what does that mean for a region?
It means that businesses in those regions are going to have a harder time staffing up as the economy is healing and continuing to grow. If people can't find childcare, they can't go to work. It's as simple as that. We talk a lot about the childcare being the workforce behind the workforce, and this sector is foundational for the success of every other economic sector in the state.
That's true. I think just to wrap up, in terms of as we look at the survey results here and then estimates of from what we understand in terms of closings, do we see the consistency of the concern about closing with what we've seen in terms of data statewide? That is, do we have a sense of how many providers have closed at this point in Minnesota?
We didn't ask that in this. I think DHS has done some, Minnesota Department of Human Services has done some surveys getting to that. And really it's pretty hard to track because programs may have closed, but they might still have their license. Maybe they're closing temporarily to try to ride out the pandemic. So it's really difficult data to capture. And other programs have, while they've stayed open, maybe they've intentionally scaled back their capacity or how many kids. And we see this particularly in family programs where they may be licensed for 10 or 12 kids, but they're, really only serving 5 or 6 kids in their program. And that's, for their own health and safety, for the health and safety of the other families. And that reduces capacity significantly, even though it's still the same maybe number of programs.
Great. Well, thanks so much, Suzanne, for presenting today and sharing all of this information. Some of you asked as well if this information will be available. Next week, we'll be emailing the slides from today's presentation and a copy of the video. There will be more information about details of the survey coming forth. And just a reminder that next Regional Economic Conditions webinar will be held Thursday, May 13th at 9 a.m., featuring Joe Mann speaking on agricultural credit conditions. So thanks so much for joining, everyone, and have a great rest of your day.